Government officials, including medical staff, have been vaccinated against COVID-19, with 300 people expected to be vaccinated today, including nurses and volunteers. Key medical workers have been vaccinated following the donation of 2,000 doses of vaccine by China, according to the Ministry of Health. At-risk groups will be vaccinated first, including medical staff, elderly people, those with a chronic illness, and migrant workers. None of those vaccinated so far have had any side effects or problematic symptoms. Speaking at the opening of the COVID-19 vaccination program on Wednesday, Deputy Prime Minister, Minister of Finance, and head of the National Task Force Committee for COVID-19 Prevention and Control, Mr. Somdi said all medical staff would be vaccinated to prevent the spread of the virus. He said, adding this was because it was possible that they had been or could come into direct contact with people infected with the virus. It was also essential to ensure that the medical staff remained in good health so they could care for any future COVID patients.
พวกเรามาเฮ็ดการสักยาแหละให้กลุ่มเสี่ยงที่สุดของแพทย์หมอ
Minister of Health Associate Professor Dr. Bunkong Siawong told reporters that other priority groups in line for vaccinations are officials working at land borders, crossings, and airports, and elderly people living in at-risk communities, such as border areas, where there have been reports of illegal migration.
เอาคาดว่าฮอด2023นี้ให้เราสักได้ประมาณ 70% ของประชากรของพลเมือง
According to Dr. Bunkong Siawong, vaccination coverage is expected to rise to 50% of the Lao population by 2022 and to 70% in 2023, with more people to be vaccinated in the following years. Laos also expected to receive COVID-19 vaccines from the Gavi COVAX facility, an initiative working to ensure global equitable access to COVID-19 vaccines. The vaccines funded by the COVAX facility are expected to be administered in April, according to the Ministry of Health. Authorities are also considering acquiring the COVID-19 vaccines produced in Russia and possibly vaccines from China, Germany, Japan, and other countries, after they have been approved and certified by the World Health Organizations and other regulators.